Thank you for choosing OakLeaf Surgical Hospital. Our healthcare team has prepared this video to assist you and your loved ones with preparation for and recovery from surgery. This is the prescription that Dr. Stewart will fill out regarding your surgery. It lists pertinent information regarding your weight-bearing status, range of motion restrictions, and appropriate exercises unique to your situation. Please refer to this for your specific rehabilitational needs. It can differ from the protocol and will be important to you and your physical therapist. Your hip arthroscopy home exercise program can be done while lying in bed. This patient's left hip is the surgical side. Ankle pumps. Pump your foot and ankle up and down. 20 repetitions each hour you are awake. Gluteal isometrics. Tighten and squeeze your buttock muscles together. Hold for 5 seconds. Repeat 10 times. Quadricep isometrics. Tighten the quadriceps muscle on the front of the thigh. Hold for 5 seconds and push the knee down into the bed. Repeat 10 times. Hamstring isometric. Bend your knee and dig your heel into the bed like you are trying to bend the knee. Hold 5 seconds. Repeat 10 times. Passive hip internal rotation. With the assist of a helper, allow the surgical leg to be rolled inward from the hip. You will feel a stretch on the outside and inside of the hip during this exercise. Repeat 10 repetitions. This machine, known as a CPM, will be used post-operatively on patients who have had the proximal femoral osteoplasty procedure. CPM stands for Continuous Passive Motion. It should be used for 1 to 2 hour sessions, 6 hours per day. The motion should be to 90 degrees of hip flexion unless you have a range of motion restriction for hip flexion on your prescription. This is 90 degrees hip flexion. Please note that the number on the pendant of the machine is more than 90 degrees, as that is a measurement of knee flexion. Stop the machine from further flexion when the hip angle reaches 90 degrees. It will be easiest to place the leg in and out of the machine when your knee is straight. Please use this on a firm surface such as a bed for safety. If you need to move the machine, please have someone help you. Bed mobility is most efficient when moving towards your strong side. However, not all homes or bedrooms are set up for that. This patient is moving towards his surgical side and using his arms and elbows for assistance. Be sure to move slowly and avoid pain. Sit at the edge of the bed before standing to reduce the risk of falling. You can rest your surgical leg on the floor. This is not considered weight-bearing. When moving from sit to stand, have your crutches by your side. Place the two crutches together on your strong side. Keep one hand on the firm surface of the bed and stand up with your weight-bearing restriction on your surgical leg, usually 20% of your total body weight. Move one crutch to your surgical side. Use assistance as needed. To take your first steps, move your crutches forward, then your surgical leg, then your good leg. This patient weighs 195 pounds. 20% of 195 pounds is 39 pounds. This patient is using a bathroom scale to practice weight bearing with 39 pounds of pressure on his surgical leg. Proper gait or walking technique requires step-by-step maneuvers. Move crutches forward. Move your surgical leg forward and place directly in between the two crutches. Step on the surgical leg with your 20% weight-bearing restriction. Land on your heel. Roll to flat foot. Push down with your hands on the crutches to take the rest of your body weight, then move your strong leg forward to meet. Your goal is to mimic normal walking mechanics with your weight-bearing restriction. When navigating stairs, either use two crutches or one crutch and a handrail. For going upstairs with two crutches, step up with the non-surgical strong leg, then bring the crutches up and then bring the surgical leg to meet. Be sure to use assistance as needed. When going down the stairs, place the crutches down, followed by the surgical leg, then bring the strong leg to meet. When moving from standing to sitting, place yourself directly in front of the chair or toilet. Move your crutches to your strong side and reach back with your other arm for support. Place your surgical leg out in front slightly and lower to sitting. When moving from sit to stand, slide forward in the chair. Place your crutches on your strong side, then move one crutch to the opposite side. When getting into the vehicle, plan ahead by moving the seat all the way back and recline slightly. When getting into an SUV or truck, walk to the vehicle and place yourself so the car seat is directly behind you. You may need to use the running board or a step. Lean on the car door, console, and car frame. Lift yourself to the seat. Once seated, pivot and lift the surgical leg into the vehicle. When using a sedan or small van, walk to the vehicle and place yourself so the car seat is directly behind you. Using both arms, lean on the car door, console, or car frame. Lower yourself to the seat. Once seated, pivot and lift the surgical leg into the car. Thank you for participating in this educational video. We hope this information has been beneficial to you and your loved ones. We look forward to your stay at OakLeaf Surgical Hospital.